Hi, church family. It's Ray David here. It's February the 18th on Tuesday, and I thought we are probably overdue for an update. So, in light of some recent developments, it's probably best that we update in this way instead of by email to save some keystrokes, and also because I wanted to find a way to talk to you in a little bit more personal way. So, let me begin with where we are in terms of Matthew's care and Matthew's help. This past Thursday morning, Matthew was discharged from McMaster, and we came home. He was wearing a Holter monitor, which generated some results. But by Friday evening, we were feeling very, very frustrated. We were feeling like we were trapped in a system that was heading into a long weekend, and we wouldn't get answers then for a few more days. We could see that Matthew was struggling physically. And so on Saturday morning, after a sleepless night, I started making all kinds of phone calls and emails, reaching out to everyone you could possibly imagine, even clinics in the US, and beginning to advocate for our son. On the Saturday at around noon, I called Tom Wright, and I reached out to Dr. Wright and asked if he knew any cardiologists or anyone that could help us, because we felt like we were trapped without answers. And so Tom said to me, I will make a couple of phone calls, I'll call you back. 20 minutes later, he called me back, and he said to call his friend, a doctor named Dr. Michael Bentley Taylor, who is the retired chief of cardiology at the Toronto East General. So I called Dr. Bentley Taylor right away. This is around noon again on Saturday, and told him the whole story of Matthew. He was quite concerned for Matthew and for the care that he was getting. And so Dr. Bentley Taylor said to us, could you come see me? And I said, anytime. And he said, how's 3 o'clock this afternoon? So we loaded into the car and we drove to see Dr. Bentley Taylor. And when we arrived there, Dr. Bentley Taylor said that he was brought up to speed on the story of Matthew, but he looked to me and he said, could you tell me a bit about your family history? And so I told him, I said, my father had heart issues in his 40s. My grandfather had his first heart attack at 47. His siblings had heart issues, and my cousins, and started. In telling this story, I realized that we have an abysmal family history as it relates to the heart. And so Dr. Bentley Taylor heard this, and he said, and how are you? And I said to him, I'm great. I'm a picture of health. Exercise 3 days a week, ride mountain bikes, surf. I feel great. Great. And he looked at me and he pointed his finger and he said, you don't know that. And he said, we're going to get to that in a moment. So anyway, then he stripped Matthew down to his underwear and ran all kinds of tests on Matthew. He requested and reviewed the Holter results from the monitor that Matthew had been wearing. He said Matthew certainly has an atypical electrocardiogram. He has an enlarged right ventricle. He has a murmur. He has a few things going on in his heart that we want to drill into. And so Dr. Bentley Taylor prescribed several tests over the next week or two for Matthew, including another echocardiogram, a cardiac MRI, a CT cardioangiogram. I'm getting far too knowledgeable in these things. But basically, the bottom line with Matthew is there is an underlying issue. It does not appear to be immediately life-threatening, and so we're thankful for that. And now we just have to figure out what it is. Dr. Bentley Taylor spent 2.5 hours on Matthew, and that was an answer to prayer, because all of Friday night and all of Saturday morning, we were desperately praying and longing to find an advocate. We said we need to find someone who will take this seriously. We have a 17-year-old athletic boy who has chest pain, shortness of breath, heart rate is spiking even when he's just laying sedentary, and a massively elevated troponin level, which if you're not familiar with that, that's a hormone that the heart releases when it is under distress. And so we were, all day Friday and Saturday, we were thinking we just need someone to take this seriously and move it forward. And so Dr. Bentley Taylor was an answer to prayer, because he did just that. So after the 2 or 2.5 hours of him examining Matthew, Dr. Bentley Taylor looks at me and he says, "Okay, young fella, shirt off, on the table." So I took off my shirt, lay down on the table. He dry shaved my chest, which was not a lot of fun. And he hooked up the electrocardiogram to me. A couple of minutes passed by and he goes, looked over at Matthew and he said, "Matthew, I'm not immediately or urgently concerned about you." He said, "But your dad is another story." And so as it turns out, I have heart problems myself that are urgent and serious and have been uncovered by Dr. Bentley Taylor. So to be honest, church family, at this point we have more questions than answers. I am heading for urgent tests starting tomorrow morning. I will be doing an echocardiogram and a cardiolite exercise test. I am on an urgent list for an angiogram where they will go in through my wrist and up through the arteries and look at my heart. We anticipate that they will find something that needs to be treated. We just don't know what or to what extent. And so I wanted to update you on those two matters. First of all, to let you know how Matthew is doing. And secondly, this unexpected news of how I'm doing. This probably means that I will be away from church and away from work for an indefinite period. We don't know. If it's something as simple as stents that need to be put in, I might miss as little as a week. If it's something more serious like bypass surgeries or something like that, it could be months. Either way, I met with the executive council and staff just last night, brought them up to speed, and I'm thankful to have the team in place that we have. Len and Brian and Jillian will continue to look after the day-to-day operations of the church and pastoring you folks. The executive council has measures in place to look after the annual general meeting and also some of the policy business of the church in my absence. It's going to be just fine. And I'm going to be just fine. In fact, that's the last thing that I wanted to tell you. I wanted to tell you about Matthew. I wanted to tell you about me. And then I wanted to tell you about God. Because I hesitate to even admit the depths of darkness and despair that we've been through over the last week with our concern for Matthew. There were times where we certainly felt God forsaken. There were times where we were wondering what it was all about. Didn't seem like there was any good plan. Then, Matthew and I get in the car and we're leaving Dr. Bentley Taylor's on Saturday. And Matthew says to me, he said, "I can see God's good plan in this." He said, "Because Dad, I would gladly go through it all to save your life." And really, friends, that's exactly what has happened. Apart from this incident with Matthew and his need for care, apart from Tom Wright's intervention in getting us in to see Dr. Bentley Taylor right away, I would more than likely have had a heart attack of some kind over the next, who knows, weeks, months, couple of years, that could have either killed me or radically changed the trajectory of my life. And so we believe that in the providence and care of God, Matthew had to be examined. I have now been examined, and we will diagnose both and we will treat both, and thank God. Thank God for that. Thank you. Thank you for praying for my son, for our son, for me, for our family. Please continue to keep our family in your prayers, and I look forward to seeing you all soon. God bless you.